Mercy Claremont Telemetry Unit by Lainey Shields, Shanoa Dixon, Rachel Pound, Haley Limoges, Catherine Scott, Haley Mantle, and Colin Davis.
We chose this topic because we are on a telemetry unit floor. Our patients have to constantly be monitored, and we studied EKG strips with our clinical instructor. She expressed how important it is to be able to read them and to know if your patient is in AFib or has a dysrhythmia.
The telemetry units are utilized for patients to constantly be monitored who are at risk for life-threatening dysrhythmias and sudden death. The patients are electronically monitored 24 hours a day, and trained technicians are able to view their heart rate and heart rhythm from the nurse's station. Any changes in these two things are communicated to the registered nurse and can be addressed immediately. The telemetry unit provides a more intense level of care than a typical inpatient medical unit, but a less intense level of care than the intensive care unit. Since patients on the telemetry unit are continuously and remotely monitored, leads are attached to their body and connected to a small box that is placed in the patient's hospital gown pocket. The leads and box transmit the patient's heart rate and rhythm to the monitoring device. The nurses on the telemetry unit work with patients who are often at a high risk for complications, so they must carefully review equipment and data to detect potential symptoms of distress or danger. The nurses need to have advanced medical knowledge, technical expertise, compassion, and strong interpersonal skills to care for these patients who may have life-threatening conditions. The duties of the nurses on this floor include reviewing data from the equipment to track their patient's heart rate, blood pressure, breathing, and other vitals. They also administer medications and communicate with their patients regarding their current conditions, which is a more traditional nursing duty. In some cases, telemetry units may also be used to monitor patients with sleep disorders or neurological issues such as epilepsy. Some important skills required for a telemetry nursing career include being technologically advanced and having a strong ability to interpret data since they're working with very sophisticated equipment, strong multitasking abilities since they're caring for multiple patients at once, sensitive and be able to ease the patient's and family's concerns, good communication skills to keep the patients informed on their current condition, and most importantly, telemetry nurses need to be able to educate their patients on healthy diet and exercise, disease prevention, and lifestyle changes that are needed once the patient leaves the hospital.
Mercy Claremont uses 5 electrode monitors, which can easily detect rhythm irregularities and ST segment deviations. This increases the likelihood for ischemic attacks to be noticed. The leads monitor electrical activity in the heart. Physical activity, heavy body hair, sweating, and multiple other factors cause the leads to fall off. The leads must be changed daily to reduce skin breakdown. Skin care must also be performed before applying new leads. The black lead is placed on the left upper chest, close to the left shoulder. The red electrode is placed below the rib cage on the left upper quadrant of the abdomen. The white electrode is placed on the right upper chest, near the right shoulder. The green electrode is on the right upper quadrant of the abdomen. The brown electrode is placed in the middle of the chest, near the right lung and xiphoid process. The 2 left-sided leads, which are black and red, monitor the left side of the heart, while the 2 right-sided leads, that are white and green, monitor the right side, offering a balanced image of the heart. The brown lead monitors the sternum and a partial right-sided view of the heart. The purpose of teaching our patients where their electrodes go is to eliminate stress on the nurses and also give us more accurate heart monitoring results. If a patient could replace their lead correctly, it would improve their quality of care.
These are the steps for skin preparation. First, wash the patient's skin with soap and water. Second, rinse the patient's skin well to remove all of the soap residue. Third, wipe the patient's skin with an alcohol swab. Fourth, rub the patient's skin with gauze to increase capillary blood flow and remove skin cells and oil. These are the steps on how to place a lead on a patient. First, clean the skin on the patient where the electrode will go with an alcohol rub. Second, place the electrode on the correct area on the patient's skin by pressing on the outer adhesive area only. Make sure to not press on the electrodes too hard when placing them. Third, make sure to secure the transmitter so it will not pull against the electrode wire as the patient moves around. Here are some things a nurse must do to maintain the leads. First, the nurse should check the battery status on each telemetry device during each shift. The device will sound an alarm when the battery are in need of changing. Second, they should change the leads every day. Third, they should explain the need and importance of the telemetry monitor to the patient once a day. Lastly, they should make sure to check for rashes or redness around the skin that the leads are attached to.
Continuous monitoring of telemetry strips allows for nurses, typically the charge nurse, to constantly watch electrical signals from your heart to detect irregularities. This is beneficial to nursing because it allows the nurse to be elsewhere while still having an eye on potential changes in the patient's status. Not only do telemetry monitors give continuous ECG reports, but they also do SpO2 status as well. Telemetry leads attach directly to the patient's chest into a small box that sends signals to the monitors at the nurse's station. This allows the patient full range of motion and activity, whereas bedside cardiac monitors pose a greater fall risk because of their confinement from wires. Fewer lines confining a patient to the bed is safer and favorable for patients.
The telemetry box receives all the signals that the electrodes give. This allows patients to be able to do what they need around the hospital without having to be attached to the monitor. The box cannot get wet, so when a patient has to take a shower, the nurse must take it off and approve of the removal of it. If they're taking a bath at the sink or doing a bed bath, they can keep it on. It must be on at all times and cannot be removed.
Health literacy is the ability to which a person can understand and process basic health information. A person's health literacy is dependent on many different factors, including their culture, stress levels, the communication skills of the health professionals, and many other factors. Some patients have unique beliefs, values, and practices. For example, some women may want to be more conservative and will want to stay as covered as possible while placing the leads on their chest. Stress levels of your patient may also be high because of the stress of their disease process and the fact that they're in a hospital and not at home, which can affect how well a person listens and remembers information. A patient's health literacy can affect their ability to get the care that they need. They may have trouble filling out paperwork, communicating their health issues with their healthcare provider, continuing proper self-care when at home, and understanding risks and probabilities. As healthcare providers, we have to be aware of our patients' health literacy level and adjust our speech and vocabulary accordingly. Plain language is a communication strategy to make information easier to understand. Medical terminology should be defined and explained in simple terms, and the most important points should be put first. When explaining to patients the purpose and placement of the telemetry monitors, their health literacy needs to be kept in mind.
An easy saying that can help you remember where to place the electrodes is smoke over fire, sky over grass, and dirt in the middle. This can help nurses, staff, and patients all understand where each electrode goes.
Some examples of barriers that could disrupt the learning process of this topic include patients that are visually impaired, cognitively impaired, hard hearing or deaf, lack of readiness to learn, elderly, non-compliance, and functional losses like limited mobility and limited fine motor skills. If a patient has a hearing impairment, teach the skill or topic in a quiet environment. Make sure their hearing aid is functioning properly. Touch first, then call by name to get their attention. Sit close to their good ear. Take turns speaking one at a time. Speak slow and clear. Use repetition and if the patient speaks a different language, an interpreter may be needed. If a patient is visually impaired, make sure they have their contacts or glasses. Use verbal instructions, be descriptive, avoid glossy materials to reduce glares, use touch and objects to reinforce instructions, use larger font if using printed materials. If a patient has a cognitive impairment, it will help to be brief and selective in information. Teach in short, frequent sessions, focus on one bit of information at a time, be consistent in words used, use simple words familiar to the patient, link new learning to past experiences, use visual aids, reminders, lists, timers, alarms, and repeat information several times.
Hey guys, welcome back. It's Nurse Karma, and today we're going to be talking about how to properly place those leads on your patients. What do you think about that, Gizzy? Great job, Mom! Alright guys, so I remember being in the hospital, being there for my first time ever, and nobody ever taught me how to properly place leads on a patient. So the nurse asked me, oh, can you go put the leads on this patient? And of course, I didn't want to sound like I didn't know anything, so I was like, oh yeah, of course. And I was like, oh, I'll figure it out in the room. So as I go in there, I'm like looking for the instructions on the cardiac monitor, like, what am I supposed to do now? And since it took forever for me to come back, the nurse comes in, she checks on me, and she goes, what's going on? And that's when I told her, I'm like, I don't know where any of this stuff goes, I'm so sorry. And she was like, oh, don't worry, I'm gonna teach you a quick little technique that I learned that you'll never forget. And I wanted to share this with you guys. Alright guys, so the nurse shared with me this acronym, and you guys might think it's kind of stupid, but for some reason it's stuck in my brain, and I hope it'll stick in yours. So she said it's basically like, what ingredients do you need in order to make a burger? So we start out with salt, then pepper, and we place these leads right below the clavicle. Then on the right lower side of the abdomen we put our lettuce. Then on the left side we put tomatoes, and then right in the middle we put the buttons. Another acronym that they taught me that's also very effective and very commonly used is, we start off on the left side placing the leads, and we say smoke over fire, then snow over grass, and in the middle we have dirt.